Welcome to the Hindu Daily. Today we're diving straight into some really critical issues facing India, starting with a topic that touches almost everyone, the mental health crisis. We see these heartbreaking stories, don't we? Like the recent tragedy in Shahjahanpur or the ongoing student suicides in places like Kota.
Yes, and it's crucial to understand these aren't just isolated incidents. They really are symptoms of a much larger systemic issue that's playing out across the country.
So what does the data actually tell us about the scale of this?
Well, the latest NCRB report from 2023, it's pretty stark. Over 171,000 suicides recorded.
That's a staggering number.
It is. Now, technically, the rate per 100,000 people dipped slightly, maybe about 0.8%, but that's mostly due to population growth. The sheer volume is alarming.
And are there patterns? Like, where is this happening more?
Yeah, we see higher rates in cities, which probably reflects, the unique pressures of urban life. And something quite striking is that men account for the vast majority of victims, nearly 73%.
73%. Wow. And the causes? What's driving this?
The primary drivers listed are family problems. That's almost a third, about 31.9%.
A third. So the home environment itself is a major factor for many.
Exactly. And following that is illness, accounting for another 19%. So personal circumstances, health, family, these are huge pressures.
And what about specific groups? I know there's been a lot of concern about farmers, for instance.
Absolutely. The agrarian sector is under immense distress. In 2023 alone, nearly 11,000 farmer suicides. And if you look back since 2014, it's over 100,000, often linked to debt, institutional neglect.
100,000, that's devastating.
It truly is. And then there's another group, often less visible in the data, homemakers, caregivers, mostly women. They face high rates of depression, marital distress, but their struggles often get overlooked.
It's like an invisible crisis within the larger one.
Precisely.
There was also this quite poignant point in one of the articles about someone turning to AI, like ChatGPT, for support during a moment of panic.
Yes, that really struck me too. The writer felt safer talking to an algorithm than a person.
What does that tell us? Is it about trusting tech?
I don't think it's about trusting technology necessarily. It's more a reflection of, institutional collapse and a deep sense of loneliness. People feel they have nowhere else to turn.
So the system isn't there for them.
Essentially, yes. We have around 230 million Indians estimated to have mental health disorders, but maybe 4 out of 5 get no formal care whatsoever. It's a huge gap.
And why is that gap so enormous? Is it resources?
Resources are definitely a major part of it. We have a severe shortage of professionals. Think about this. Only 0.75 psychiatrists per 100,000 people. The WHO recommends something closer to 3, ideally more.
0.75.
Yeah.
That's less than a quarter of the minimum recommendation.
Exactly. And it's not like we don't have policies. The Mental Health Care Act of 2017 was landmark legislation. It guarantees care, decriminalized suicide attempts.
Right, progressive on paper.
Very progressive. We also have national strategies, like the NSPS from 2022. But despite all this, suicide numbers have actually continued to rise.
So the laws are there, but something's missing in implementation.
Implementation, funding. It's a combination. And get this, there's a dedicated mental health budget, around 270 crore, but reports show it's largely gone unspent.
Unspent. That's unbelievable with such a crisis.
It points to a massive disconnect. The policy exists, but the resources aren't being deployed effectively.
So what's the way forward then? What needs to happen?
Okay, first, this needs to be treated like the emergency it is. That means, perhaps, a high-level, cross-ministerial task force involving health, education, agriculture, the works.
Thinking holistically about it.
Yes. Second, counseling needs to be seen as public infrastructure, not some kind of charity add-on. We need mandatory, full-time, trained counselors in schools, colleges, even in agrarian blocks, and funded centrally.
Making it accessible everywhere.
Absolutely. And third, we urgently need to look at the digital space, those AI tools people are turning to. They need regulation, mandatory disclaimers, clear pathways to real crisis support.
That makes sense. Okay, let's transition slightly and dig deeper into the formal healthcare system itself. We touched on the MHCA 2017.
Right, the Mental Health Care Act. A huge step forward legally. It enshrines the right to care, focuses on patient dignity. And the Supreme Court backed this up, clearly stating mental health falls under Article 21, the fundamental right to life.
So the legal framework is strong.
The legal framework is definitely there. And we have government schemes too, like the District Mental Health Program, the DMHP. It's meant to decentralize services, and nominally, it covers all 767 districts now.
And there's Telemanast too, right? The helpline.
Yes, Telemanis. It's a 247 service, and it's actually provided over 2 million telecounseling sessions. That shows there is potential for reach, especially using technology.
2 million sessions. That sounds impressive. But you mentioned earlier that 4 out of 5 people still don't get care. How do we reconcile that?
That's the crucial point. These quantitative achievements, like district coverage or number of calls, they can mask a deeper functional failure. The National Mental Health Survey back in 2015-16, it laid bare the reality.
What did it find?
It found massive treatment gaps, depending on the disorder, between 70% and 92% of people weren't getting the care they needed. For common disorders like depression or anxiety, it was around 85%.
85% treatment gap for common issues.
Yeah,
That's where the system seems to be failing most people.
precisely. That number really captures the scale of the systemic failure, despite the laws and schemes.
And we come back to the workforce issue.
We keep coming back to it. That figure, 0.75 psychiatrists per lakh, it's a crippling bottleneck. And the DMHP, even where it exists on paper, often doesn't function well on the ground. We hear about frequent stockouts of essential medicines at primary health centers.
So even if someone reaches out, the help might literally not be there.
Exactly. Plus, there's still significant stigma. Over half of Indians, according to surveys, still attribute mental illness to some kind of personal weakness, which prevents people from seeking help in the first place.
Who does India compare internationally on this?
Well, if you look at countries like the UK, Australia, Canada, their treatment gaps are lower, maybe around 40% to 55%. Still significant, mind you, but much better than our 85–90%.
And the funding difference.
That's where it's really stark. Those countries typically allocate around 8% to 10% of their total health budget to mental health.
8 to 10%. And India.
India allocates just 1.05%.
1%. That's a huge disparity. It says a lot about priorities, doesn't it?
It really does. It's frankly embarrassing on a national level, so the required reforms are quite clear.
What are the key steps?
First, that budget needs to increase drastically. At least 5% would be a starting point moving towards international norms.
A 5-fold increase, minimum.
Minimum. Second, we need to rapidly scale up what are called mid-level providers. These are trained counselors, psychiatric social workers, nurses who can deliver a lot of the essential care. They handle about half the counseling services in many other countries. This is key to tackling the urban-rural divide.
Using different tiers of professionals to fill the gap.
Exactly. And third, our national guidelines need updating. The WHO's ICD-11 includes newer conditions like gaming disorder, complex PTSD. Our protocols need to reflect these contemporary realities to provide relevant care.
Okay, shifting gears now from healthcare policy to political strategy. There's a noticeable trend, isn't there, of political parties targeting women voters specifically?
Yes, definitely. We're seeing more and more major welfare schemes designed explicitly for women, like Mukhyamantri Mahila Rojgar Yojana or Madhya Pradesh's Ladli Behna Yojana.
And the big question is, does this actually empower women politically, or is it a different kind of marginalization?
Well, it's a complex debate with sort of two sides to it.
Okay, what's the positive view?
The positive take is that these schemes can genuinely give women more agency. Providing them with direct income they can control and dispose of themselves is empowering. Think back to the early 2000s when schemes gave free cycles to schoolgirls that had real tangible social benefits, increased mobility, and education.
Right, direct benefits can make a difference. But you mentioned a downside or apprehension.
Yes. The apprehension comes from the framing. When women are primarily addressed as Labharthi's beneficiaries, it risks reinforcing the idea that they are a non-political group. Meaning, they are seen as deserving of aid, but perhaps not as central players in the actual political contest or decision-making, which remains sort of a male domain. You often hear politicians refer to women voters as sisters, which, while seemingly positive, can subtly reinforce this marginal role.
Interesting framing. But electorally, are these schemes working for the parties?
They certainly seem to be. The Ladli Behna scheme is widely credited with helping Shivraj Singh Chauhan secure victory in Madhya Pradesh. Cash transfers can be very effective politically.
But it's not foolproof.
No, implementation is absolutely key. We saw in Maharashtra, for instance, a similar scheme announced post-election led to quite a bit of chaos and confusion during rollout. So it's not just the promise, it's the smooth, sustained delivery that matters.
Makes sense.
And another really important point, we have to ditch this idea of a single monolithic women's vote.
Why is that?
Because gender identity never exists in isolation. It's always interwoven with caste, class, region, religion. National surveys haven't really shown a distinct women's vote emerging as a decisive bloc for any one party.
So treating women as one uniform group is a mistake.
It's a political simplification that ultimately renders them marginal. No matter how much money is directed their way through these schemes, they become an interest group, not core political actors.
This idea of structural exclusion, even while being targeted as voters, actually connects to another topic later on electoral rolls. But first, let's pivot to a completely different kind of challenge: communication. Specifically, antimicrobial resistance, or AMR.
Ah, yes, AMR, a silent pandemic in the making.
It really hit the headlines around 2010, didn't it? With the NDM enzyme, the New Delhi metallobatylactamase, that brought some scary predictions.
Extremely scary. The headline figure was often 10 million deaths globally per year by 2050 if AMR wasn't tackled. And that initial shock, that language of catastrophe, it did work for a time. It got policymakers' attention.
But you're saying it doesn't work anymore.
Largely, no. We've been repeating those same dire warnings for over a decade now. And the problem is that kind of communication runs into psychological barriers.
Like what?
Two main ones. First, habituation. Just hearing the same warning over and over again dulls its impact. We get used to it. Second, and perhaps more importantly, psychic numbing.
Psychic numbing. What's that?
It's our inability to emotionally connect with vast numbers. 10 million deaths is too big, too abstract. It doesn't feel real. As one source aptly put it, statistics are human beings with the tears wiped off. We lose the personal connection.
So the focus on the huge, distant catastrophe backfired in a way.
It seems so. The urgency faded because it felt remote and impersonal. So the communication strategy needs a fundamental shift.
From the future collapse, too.
To the present impact on the individual. We need to talk less about societal resistance statistics in 2050 and more about biology, right now specifically, our microbiome.
The microbiome, the trillions of bacteria and other microbes living in and on us.
Exactly, our good bugs. This vast community is absolutely essential for our survival. They help digest food, they train our immune system, they even communicate with our brain via the gut-brain axis, influencing things like mood and anxiety.
So they're vital for health.
Critically vital. And here's the connection to AMR. Even a single course of antibiotics can severely disrupt this delicate ecosystem. It can wipe out beneficial bacteria, and this disruption can last for months, potentially increasing the risk of other health issues later, like asthma or obesity.
So antibiotics have an immediate personal cost, beyond just the risk of resistance later.
Precisely. That's the message that resonates now. It's not just about some abstract future threat to hospitals. It's about potential harm to your body, your health today.
How do we make that concept, stick? The microbiome can still feel a bit abstract.
Well, there's a fascinating, relatable example: perfume.
Perfume, how does that connect?
Why does the exact same perfume smell slightly different on you compared to someone else? It's your unique skin microbiome at work.
Really?
Yes. The bacteria on your skin have enzymes that metabolize, break down, and even amplify the fragrance molecules in different ways. So your personal scent profile is partly created by your microbes.
That's amazing. It makes microbes seem less like just germs and more personal, part of our identity.
Exactly. It shifts the perception. Microbes aren't just about disease. They're about individuality, digestion, immunity, even beauty. They are essential partners.
So the new messaging should focus on that partnership.
Yes. Instead of the old warning about societal resistance, the message becomes much more direct and personal. Antibiotics can harm your microbiome.
And the call to action.
It shifts from abstract dread to immediate personal responsibility. Protect your good bugs, they protect you. It's about wisdom and collaboration with our microbial partners, not just fear of resistant superbugs.
That feels much more empowering. Okay, let's connect back to that idea of systems and participation we touched on earlier. Moving to electoral processes, specifically the revision of electoral rolls.
Right. Article 5 in our sources looked at the Special Intensive Revision, or SINR, process that the Election Commission recently conducted in Bihar.
And this is set for a national rollout eventually.
That's the plan, a phased rollout across the country. It's done under the Representation of the People Act, 1950, and the goal is essentially to clean up the voter lists, make sure they're accurate and up to date.
How does it actually work? What's involved?
It's quite a thorough process. Enumerators go out, forms are submitted by voters, and critically, for anyone registered after 2003, they need to provide specific documents to prove citizenship.
Documents for citizenship.
Yes, there's a list of acceptable documents. Then there's verification, publication of draft rolls for people to check, and then the final roll. It's labor-intensive but vital for democracy.
Did the recent Supreme Court ruling on Aadhaar affect this?
Yes, the court directed the Election Commission to accept Aadhaar as one of the valid proofs of identity, which should help streamline the documentation part for many people.
But ultimately, the accuracy depends on people participating, right? Checking the lists.
Absolutely. Citizen responsibility is key. People need to check the draft rolls when they're published, make sure their details are correct, and especially new voters or people who've moved need to fill out the necessary forms, like the RER 1960 forms.
And this is where we link back to the earlier discussion about exclusion.
Exactly. This process highlights the need for assistance, particularly for marginalized groups. The SR exercise in Bihar, for example, reportedly found that more women were left off the rolls compared to men.
Why was that?
Primarily due to issues with documentation. They might lack the specific proofs required. We saw similar patterns during the NRC exercise in Assam.
So the very process designed to ensure democratic participation can inadvertently exclude people if they don't have the right paperwork.
Precisely. It creates a paradox. We celebrate voters, maybe even target them with schemes, but the administrative process itself can erect barriers, especially for women and other vulnerable groups whose documentation might be weaker. It really underscores the need for political parties and civil society groups to actively help people navigate this process.
A crucial point about ensuring inclusion isn't just symbolic. Okay, let's shift from national processes to a more local, business-focused story. Article 6 deals with a kind of revolt in the food delivery sector in Tamil Nadu.
Yes, it's quite interesting. Restaurants in smaller towns like Namakkal and Cuddalore are apparently logging off the big platforms Swiggy and Zomato.
Logging off entirely. Why?
The main reasons cited are the business models of the big aggregators, primarily the very high commission rates, sometimes reaching 30–35% plus GST.
35% commission.
Yeah.
That eats significantly into margins, especially for smaller places.
Hugely. And on top of that, they mentioned unilateral deep discounts being imposed by the platforms, which further squeezed their profits. Many smaller hoteliers felt they were losing money and, maybe not being digitally savvy enough, felt powerless to contest the terms.
So they felt trapped. What's the alternative they're turning to?
A homegrown platform called Zaros. It was founded in Chidambaram and now operates in over 50 Tier 2 and Tier 3 locations across Tamil Nadu.
And how is Zaros different? What's its model?
It's fundamentally different. Instead of taking a percentage commission on every order, Zaros uses a flat monthly subscription fee.
Ah, okay. Like a sauce model.
Exactly. It's around 3,000 plus GST per month for larger restaurants and about half that €3,000 ones for smaller ones.
And that makes a big difference financially.
A massive difference, according to the restaurant owners. In Namakkal, they estimate they're saving around 90% of what they used to pay in commissions.
90%, that's huge.
It allows them to be more competitive, even lower their menu prices, passing savings on to customers, and retain much more of their earnings. The local hotelier associations see this as a really important pilot.
But can a local player like Zaros realistically compete with the giants like Swiggy and Zomato in the long run? They have such deep pockets.
That is the million-dollar question, isn't it? It's incredibly challenging. We've seen other local alternatives try and unfortunately fail. Kerala had an app called Rezoy, but it reportedly struggled with rapid expansion, logistical hurdles, and retaining delivery partners when competing against the incentives offered by the big players.
So Zaros has a tough road ahead.
Definitely. They need to ensure service reliability, manage growth carefully, and really build customer loyalty to withstand the competitive pressure. But it's a fascinating example of local businesses trying to reclaim control.
Indeed. Okay, for our final piece, let's take a leap into a completely different realm, fundamental physics. Article 7 discusses macroscopic quantum phenomena. This sounds mind-bending.
It really is. We're talking about the work of researchers like John Clark, Michel Devore, John Martini's names likely heading for a Nobel Prize, perhaps even in 2025.
And what does they achieve?
They essentially demonstrated that quantum mechanical effects, which we usually associate with the microscopic world of atoms and electrons, can actually occur and be observed in electrical circuits large enough to be seen, well, almost with the naked eye.
So bridging the quantum and the classical worlds.
Exactly. Making the weirdness of quantum mechanics manifest in something tangible, engineered. The groundwork for this was laid much earlier, back in 1962, by Brian Josephson.
The Josephson effect, right?
That's the one. He predicted that pairs of electrons, Cooper pairs, could tunnel quantum mechanically across a thin insulating barrier between two superconductors. This creates a supercurrent that flows without any voltage applied.
Tunneling. Like passing through a wall they shouldn't be able to get over.
Precisely. And the key concept behind it is quantum phase. In a superconductor, all the electron pairs behave like a single, coherent quantum wave with a specific phase.
Okay. Phase like the timing of a wave.
Sort of. Think of it like two groups of dancers perfectly synchronized within each group, but maybe slightly out of sync with each other. That offset between the two waves, the phase difference, is what drives the Josephson supercurrent. The current, I, is proportional to the sign of the phase difference, IEX.
And this was confirmed experimentally.
Very quickly, Josephson won the Nobel Prize for it in 1973. It was a major breakthrough.
So where did the next leap come from?
That came from the theoretical physicist Anthony Leggett, starting in the 1970s. He asked a really profound question. Could a variable describing the entire macroscopic system, like that phase difference involving potentially trillions of synchronized electrons itself, behave quantum mechanically?
Taking the quantumness from the electron pairs to the whole circuit variable.
Exactly. He modeled this phase difference conceptually as like a tiny marble trapped in a valley on an energy landscape. Classically, the marble needs enough thermal energy, enough jiggling to roll up and over the hill, the energy barrier, to switch to a different state, a different valley.
Right, needs a push.
But Leggett predicted that if you cooled the system down close to absolute zero, removing almost all thermal energy, the marble shouldn't be able to roll over the hill. Yet, quantum mechanically, it could still get to the other side by tunneling right through the barrier.
Quantum tunneling for the entire macroscopic state.
That was the prediction. He theorized that this macroscopic variable could exhibit quantum behavior, provided you could isolate it from environmental noise or decoherence.
And this is what Clark, Deverett, and Martinis managed to prove experimentally.
Yes, this is their huge contribution. They built these tiny superconducting circuits, cooled them down to millikelvin temperatures incredibly close to absolute zero. Then they watched how often the circuit spontaneously switched states, like the marble jumping the barrier.
What did they find?
They found that as they lowered the temperature, the switching rate decreased, as expected classically because there's less thermal energy. But below a certain temperature, the rate stopped decreasing. It leveled off at a constant value.
It kept switching even without thermal energy.
Exactly. And that constant temperature-independent switching rate perfectly matched the predictions for macroscopic quantum tunneling. The marble was indeed passing through the wall.
Wow. How did they confirm it further?
They used spectroscopy. If this macroscopic variable, the phase difference, was truly behaving like a quantum object, it shouldn't be able to have just any energy. Its energy level should be discrete, quantized, like the energy levels of an atom.
Like steps on a ladder, not a smooth ramp.
Perfect analogy. So they shone microwaves onto the circuit, and they found it only absorbed the microwave energy at specific discrete frequencies, corresponding exactly to the energy differences between these quantized levels. It was undeniable proof of quantum behavior in a macroscopic engineered object.
Absolutely stunning. And this has practical applications, right? It's not just fundamental physics.
Oh, hugely practical. This work is the absolute bedrock of what's called the superconducting qubit.
The basic building block of quantum computers.
Precisely. That macroscopic variable in their circuit, the phase difference, or a related quantity like charge exhibiting quantum properties like tunneling and superposition, is the qubit. And because it's macroscopic, engineers can more easily control it, manipulate it, and measure its state compared to, say, a single atom.
So this research directly enabled the quantum computers being built today.
It's foundational. It showed how to create a controllable macroscopic quantum system, which is exactly what you need for building scalable quantum processors. They took quantum mechanics out of the purely microscopic realm and put it into engineered devices.
A truly remarkable bridge between two worlds of physics. Thank you for listening. If you want to provide suggestions, please contact on the Twitter handle given in the episode description. As always, we are eager to hear what our listeners want to be informed about. We wish you a great day.